This module will review advanced preparation for joint replacement surgery. Getting yourself ready for surgery can improve the process of recovery and the final outcome. This includes the following: general health and wellness, nutrition, weight control, prehabilitation exercises or exercises before surgery, home preparation, and obtaining medical equipment. Improving your general health before surgery can lower the risk of complications. Any chronic health conditions should be well controlled. Patients with diabetes should have a hemoglobin A1C of 7.5 or less. Regular exercise to improve cardiovascular health and overall strength has a proven benefit. Patients who smoke should aim to cease or significantly reduce nicotine use 6 weeks prior to surgery. Alcohol consumption should also be minimized in the weeks prior to surgery. Improving your nutrition prior to surgery can strengthen your immune system and boost your healing capacity. It can also improve your bone quality and help strengthen your muscles before and after surgery. Poor nutrition has been linked to a higher risk of infection. Consider vitamin and mineral supplementation in the weeks prior to surgery. A multivitamin, vitamin D 2,000 international units daily, and vitamin C 1,000 milligrams daily are recommended as soon as you make the decision for surgery. A Mediterranean diet is also beneficial in helping with weight reduction, inflammation reduction strategies, and in improving your healing capacity. And we recommend that patients consider adopting a Mediterranean diet in the weeks prior to their surgery. Both magnesium and zinc have many benefits, which include better immunity to resist infection, better wound healing, reduced inflammation, and pain reduction. These can be bought as a combined supplement with calcium, which also helps strengthen bone. We recommend getting a combined supplement and taking one pill twice a day with breakfast and dinner as soon as your surgery is scheduled and until 4 to 6 weeks after your surgery. Protein supplementation also has proven benefit. Protein, and specifically the amino acid leucine, is key for healing, and protein supplementation before and after surgery has the following benefits: reduced infection risk, less muscle atrophy before surgery, and faster recovery of strength after surgery. Mend is a supplement designed for joint replacement preparation and recovery, and we recommend our patients purchase this at the web address listed above and start it 4 to 6 weeks prior to surgery and continue it for 6 to 12 weeks after surgery. Studies have shown that body mass index above 40 can raise the risk of infection and other complications. Efforts to lose weight prior to surgery can improve outcomes and lower these risks. Weight loss can be difficult in the setting of arthritis pain due to difficulty with exercise. Bariatric surgery, also known as weight loss surgery, and weight loss medications are options that can be explored prior to joint replacement. Low glycemic index diets that reduce carbohydrate intake can also be effective in weight reduction. Prehabilitation exercises refer to exercises done before surgery. These are designed to strengthen the leg muscles prior to surgery, and this can help jumpstart the recovery process. This can be done either with a home exercise program or as part of a structured therapy program. Regular performance of these exercises will get you in the mode of exercising after surgery and familiarize you with what to do. We have a separate booklet that shows our recommended prehabilitation exercises that you can also review as part of this patient education process. Home preparation in advance of surgery is also important so that you can return to a comfortable and safe environment. The following are recommendations. Carry your cell phone with you at all times in the event of a problem. Set up a recovery area with easy access to the kitchen, bathroom, remote control, electronics charging, etc. Move furniture to make clear paths for navigation, providing room for use of a walker. Remove throw rugs, loose electric cords, or any other hazard that might produce a fall risk. Put nightlights in areas like the bathroom to make navigation easier at night. Stock up on groceries and other essential items like toiletries and any medications you will need. Move essential items from low cabinets to waist height to reduce the need to crouch. Set up your exercise area. Prepare and freeze meals prior to surgery. Make your ice packs and pay your bills in advance. We recommend purchasing the following items in advance of surgery. A box of 4 by 8 inch Primapore dressings, which usually come 22 a box, and these can be purchased from Amazon. An adjustable height cane and an adjustable height rolling walker with wheels in the front only. These can also be purchased on Amazon, at a medical supply store, or even at a local pharmacy. For patients undergoing a total hip replacement, particularly if you are tall, getting a raised toilet seat can be helpful for avoiding too much hip flexion and rotation when getting on and off the toilet. Some patients may consider putting grab bars in their tub or shower to assist in balance. A shower chair or tub bench may also be helpful for patients with balance issues. These can also be purchased on Amazon or a medical supply company and should be installed prior to surgery. We recommend purchasing the following before surgery so that you have everything set up in advance. These can all be purchased over the counter. Tylenol Extra Strength 500 milligrams, enteric coated aspirin, usually 325 milligrams, or baby aspirin if directed. Prilosec 20 milligrams, unless you take another antacid like Protonix. An anti-inflammatory medication of choice such as ibuprofen 200 milligrams or naproxen, also known as Aleve, 220 milligrams. A bottle of Miralax, Colace 100 milligrams, and the vitamins and minerals we listed previously, including vitamin C 1,000 milligrams, vitamin D 2,000 international units, and the combined calcium, magnesium, and zinc supplement. You will need to get clearance from your medical doctor for surgery. If you see a cardiologist regularly for a heart condition or have a prior history of heart disease, cardiology clearance may be required as well. Routine lab work is also required, including a nasal swab to screen for staph bacteria in the nose. Other testing, such as additional lab work or an EKG, may be required depending on age or other medical conditions. If there are any concerns about your health history that may impact surgery, we may arrange a consultation with the anesthesiologist as well. Our surgical schedulers can help to arrange medical clearance and any testing in the weeks prior to surgery. If you have any health conditions that are not stable or well controlled at the time of surgery, your surgery may need to be delayed until your health can be optimized. This can include poorly controlled diabetes, unstable heart disease, moderate to severe kidney or liver disease, vascular disease involving the surgical leg, or any ongoing infection elsewhere in the body. You will have a preoperative appointment or telehealth visit with us about 1 week prior to surgery. During this visit, we will review your medical clearance, review your current medications, review your lab work, answer any questions, review pre-op instructions, and provide medications you will need after surgery. Be sure to bring an up-to-date list of your most current medications and dosing to this visit. Adequate pain management is an important part of our Avatar program. We cannot make surgery pain-free, but our goal is to make the pain tolerable so that you can engage in the exercises necessary to gain motion and strength. We will customize a strategy for you based on other medication you may be taking, a history of prior medication intolerance or allergy, and any medical conditions that may preclude certain medications. If you are treated for chronic pain by a pain management specialist, a clear plan needs to be developed prior to surgery regarding who will manage the pain during the postoperative period and for how long. as well as what medications are suggested in addition to your baseline pain management regimen. Decide in advance where you would like to do your postoperative physical therapy and let your care team know this. Therapy will generally start within 1 to 2 weeks after surgery, and it is best to set these appointments up in advance. Our office will fax a referral to your therapist of choice with instructions for post-op care. You should call the therapy office 1 to 2 weeks prior to your surgery to set up these appointments.